Hello, everybody. Today we are discussing about Tay-sachs disease. Tay-sachs disease is categorized as a lysosomal storage disease. Tay-sachs disease is caused by the mutation in the hexa gene on chromosome 15. The hexa gene provides instructions for making part of an enzyme called beta-hexosaminidase A, which plays a critical role in brain and spinal cord. The deficiency of beta-hexosaminidase normally degrades the lipid GM2 ganglioside. As a result, GM2 ganglioside accumulates in the lysosomes of nerve cells. The disease is also known as GM2 ganglioside type 1. This results in progressive symptoms of central nervous system degeneration. The symptoms include muscle weakness, visual difficulties, and seizure. The child with TSD usually develops normally for the first few months of life. This usually begins by 3 to 6 months of age, preceding the fatal by age of 2, 3, or 4. Tay-sachs disease is an autosomal recessive disorder. Autosomal means it affects both males and females equally, and recessive means both parents must be carried for the children to be at risk. The diagram here is explains inheritance of TSD. TSD can only be passed down to the generation if two carriers marry. It is impossible to have a child with a TSD if either parent is a non-carrier. The first picture illustrates, like the normal illustrates, that if both parents are carriers, there is a 1 in 4 probability of having a non-carrier child. And the first, second, and third illustrates that there is 50-50 probability of having a carrier child. And finally, the last one, the having a child with the TSD has 1/4 risk. The highest carrier rate in TSD occurs in isolated impaired populations includes Ashkenazi Jewish people, those who ancestors lived in Central Europe, French Canadian of Southeastern Quebec, older Amish, and Cajun of Southwest Louisiana populations. Depending on the age, onset TSD can be infantile, juvenile, chronic, and late onset. The infantile form of Tay-sachs disease is characterized by complete or almost complete lack of hexosaminidase A enzyme activity. Infants may appear completely unaffected at birth. Initial symptoms which usually develop between 3 to 6 months. The onset of juvenile Tay-sachs disease can be anywhere between 2 to 10 years of age or 2 to 5 years of age. And there is a chronic Tay-sachs which children develop symptoms age before 10. The presentation of symptoms associated with the late onset Tay-sachs disease vary greatly. Onset of disease may vary from the late teens to any time in the adulthood. The symptoms on infantile, juvenile, and chronic includes muscle weakness, myoclonic jerk seizures, visual disturbance, exaggerated style reaction, loss of motor skills, lack of attentiveness, slowing of mental, social, and physical development, cherry red spot in the eyes. And symptoms in late onset includes muscle weakness, cherry red spots, slurred speech, bipolar type psychological symptoms. Then the diagnosis of Tay-sachs. To diagnose Tay-sachs disease, measure the level of hexosaminidase A in the body through a blood test. The blood test that detects absence of very low levels of beta-hexosaminidase A enzyme activity. Also performing a careful A exam to find cherry red spots in the eyes. Genetic testing of HexA gene mutation and sequencing. And there is no cure for Tay-sachs disease, but some treatments can help in manage symptoms. Treatment in infantile and juvenile includes supportive care. This includes neurologists to manage seizures, gastroenterologists, surgeons, nutritionists for manage their feeding, and occupational or physical therapy to assist daily activities, and the counseling for the parents and relatives of children with Tay-sachs. The treatment in late onset also includes supportive care, and genetic counseling is available for people concerned they may be Tay-sachs carriers because of their ethnicity. Also, people at risk can perform prenatal diagnosis. Tests includes as chorionic village sampling and amniocentesis can diagnose Tay-sachs in babies before they were born. And pre-implantation genetic diagnosis. Specialists perform a test on embryo before implanting them in the womb. They do this to see if embryo carry Tay-sachs. And artificial insemination, ovum donation, in vitro fertilization, and gene therapy, but it is still under research. Here it shows the phylogenetic tree of TSD. Tay-sachs disease a case report. Here a case is of a 12-month-old girl brought to the hospital because of mental motor deterioration and convulsions. She was a child of first cousins and had a history of deaths of 2 siblings with the same manifestations. Generalized hypotonia, microcephaly, hyperacusis, and a retinal cherry red spot in appearance were present in her. And there was no organomegaly. The diagnosis of Tay-sachs disease was made by means of absence of serum hexosaminidase A activity. In short, Tay-sachs disease is an autosomal recessive lysosome storage disorder confined to the central nervous system, resulting from the deficiency of hexosaminidase A. Thank you.